Greetings to all participants at this celebration of Rare Disease Day in New Delhi, India. My name is Durhane Wong Reiger, and I am chair of the Rare Disease International, the global alliance of national rare disease alliances, international disease-specific federations, and regional rare disease alliances. We have members in over 100 countries, and we're proud to recognize the Indian Organization of Rare Disorders as one of the original members. The first mission of RDI is to raise awareness of rare diseases as an important public health issue. Worldwide, you may know that there are approximately 475 million persons living with one or more rare conditions. In fact, it's been said that if all the persons with rare diseases were living in one country, it would be the third largest country in the world, behind China and India, of course. There are more than 7,000 rare diseases that differ from each other, but importantly, they share the same challenges and issues, and these could in fact be affected by common healthcare policies. Many of the rare diseases, as you know, are genetic, about 80% of them, and about 50 to 75% will affect infants and children. Sadly, about 30% of children will die from a rare disorder before their 5th birthday. As you may also know, many rare diseases can be prevented if they're diagnosed early and treated, sometimes with very accessible interventions, and these can help to reduce the disabilities or even to prevent death. There are tremendous advances being made in screening, diagnosis, care, and treatment, and many of these are accessible to care providers even in remote areas now through the internet, through telehealth, and certainly through the social media. So Rare Disease Day, this last day in February, is an important occasion to call for collective action, especially at national and global policy levels, to address what we would consider to be a truly neglected set of diseases. Rare Disease International has launched a non-governmental committee on rare diseases under the United Nations and is now partnering with the World Health Organization, calling for inclusion of rare diseases in universal health care and in programs such as essential medicines. I wish I could be with you today as you celebrate this Rare Disease Day, but as president of the Canadian Organization for Rare Disorders, I'm also called upon to support our patients here. However, over the years, I've had the privilege of being in India at a number of rare disease conferences hosted by the Indian Organization for Rare Diseases. I'm so very excited, but I'm mostly impressed by the huge progress that India has made in the past few years. In addition, we're hoping that India will bring its drug research and development expertise to helping address the need for treatments. As you may know, only about 5% of the 7,000 rare diseases, have any form of drug therapy. In closing, thank you for the opportunity to share a few words with you on this important occasion. My congratulations to the Indian Organization for Rare Diseases for their leadership, and certainly to everybody here for their contribution to our global mission. Thank you.